Science and symptoms of heart attack. A heart attack occurs when the flow of blood to the heart is blocked, most often by a buildup of fat, cholesterol and other substances, which form a plaque in the arteries that feed the heart. The interrupted blood flow can damage or destroy part of the heart muscle. Heart attack, or myocardial infarction, is the #1 killer of both men and women. Most of the deaths from heart attacks are caused by ventricular fibrillation of the heart that occurs before the victim of a heart attack can reach an emergency room. Those who reach the emergency room have an excellent prognosis. Survival from a heart attack with modern treatment should exceed 90%. The 1% to 10% of heart attack victims who die later include those victims who suffer major damage to the heart muscle initially or who suffer additional damage at a later time. Fortunately, procedures such as coronary angiogram and PTCA, and clot-dissolving drugs are available that can quickly open blocked arteries in order to restore circulation to the heart and limit heart muscle damage. In order to optimally benefit heart attack victims and limit the extent of heart damage, these treatments to open blocked arteries should be given early during a heart attack. Blood pressure is not a reliable measurement of whether one is having a heart attack. Blood pressure during a heart attack can be low, normal, or elevated. Knowing the early warning signs of heart attack is critical for prompt recognition and treatment. Many heart attacks start slowly, unlike the dramatic portrayal often seen in the movies. A person experiencing a heart attack may not even be sure of what is happening. Heart attack symptoms vary among individuals, and even a person who has had a previous heart attack may have different symptoms in a subsequent heart attack. Although chest pain or pressure is the most common symptom of a heart attack, heart attack victims may experience a diversity of symptoms. The following list describes the symptoms of heart attack in more detail. Chest discomfort, manifest as pain, fullness, and/or squeezing sensation of the chest. Chest pain is the hallmark symptom of a heart attack, although it can take many different forms. In other cases, chest pain may not occur at all. The characteristic chest pain of a heart attack has been described as a sense of pressure, squeezing, fullness, or pain that starts in the center of the chest. The pain or discomfort typically lasts more than a few minutes, or it may go away and then return. It can spread down the arms, to the back, or to the head and neck. Both women and men report chest pain as a primary symptom of heart attack, but women more often than men are likely to have some of the other symptoms, such as nausea, jaw pain, or shortness of breath, that are described below. Jaw pain, toothache, headache. The pain of a heart attack can spread down both arms, to the jaw or head, or to the back. Some people report tooth pain or headache as a symptom of a heart attack. It is possible to have these types of pain without chest pain during a heart attack. Shortness of breath. Feeling short of breath or like you are gasping for air is a common symptom of a heart attack. Shortness or breath, or difficulty breathing, is medically known as dyspnea. Shortness of breath may occur before or during the chest pain of a heart attack, and in some cases, it may be associated with other heart attack symptoms. Without any chest pain. Nausea. Nausea or feeling sick on your stomach is a less common but possible symptom of heart attack. Sometimes belching or burping can accompany the nausea, and some patients have described a feeling like indigestion associated with a heart attack. Women are more likely than men to report these less typical symptoms of heart attack, and some patients have described feeling as though they are developing the flu. Vomiting. the nausea that accompanies a heat attack can become so severe that vomiting occurs. General epigastric discomfort. Sometimes the pain of heart attack is described as stomach pain, or pain in the middle of the upper abdomen. The pain usually feels more like discomfort of heaviness rather than sharp, stabbing pain, and the pain tends to persist more than a few minutes. This can occur with or without pain in the true chest area. Sweating, or perspiration, can accompany a heart attack. Some people have described feeling like they are breaking out in a cold sweat. Heartburn and indigestion. As mentioned above, some people experiencing a heart attack can have belching and burping and describe a feeling of indigestion. Likewise, the pain and pressure of a heart attack may occur in the epigastric or upper middle abdominal area, similar to the pain of heartburn. Arm pain. The chest pain of a heart attack can spread, or radiate, down one or both arms and to the shoulders. This often happens, and the pain may even extend to the wrist and fingers. This is most common on the left side of the body, but it can also occur on the right side. Upper back pain. The upper back is another common location for spread of the pain from a heart attack. Most commonly, back pain that stems from a heart attack is described as occurring between the shoulder blades. General malaise. A feeling of being generally unwell or like you are coming down with an illness can accompany a heart attack. This can be described as fatigue or even lightheadedness. With or without fainting. Some people will experience severe anxiety or panic during the heart attack. This has been described as feeling a sense of doom, as one experiences with a panic attack. No symptoms. Approximately 1/4 of all heart attacks are silent, without chest pain or new symptoms, and silent heart attacks are especially common among patients with diabetes mellitus. Even though the symptoms of a heart attack at times can be vague and mild, it is important to remember that heart attacks producing no symptoms or only mild symptoms can be just as serious and life-threatening as heart attacks that cause severe chest pain. Too often patients attribute heart attack symptoms to anxiety, indigestion, fatigue, or stress, and consequently delay seeking prompt medical attention. One cannot overemphasize the importance of seeking prompt medical attention in their presence of symptoms that suggest a heart attack. Early diagnosis and treatment saves lives, and delays in reaching medical assistance can be fatal. A delay in treatment can lead to permanently reduced function of the heart due to more extensive damage to the heart muscle. Death also may occur as a result of the sudden onset of arrhythmias such as ventricular fibrillation. Not all people who have heart attacks have the same symptoms or have the same severity of symptoms. Some people have mild pain, others have more severe pain. Some people have no symptoms, while for others, the first sign may be sudden cardiac arrest. However, the more signs and symptoms you have, the greater the likelihood you're having a heart attack.